In this instructional video, we will cover all the steps taken to successfully perform a paracentesis. The topics of indications and contraindications, complications and their management, and diagnostic fluid studies will be covered in other videos. Before beginning a non-emergent bedside procedure, consent should first be obtained from the patient. A brief description of the steps included in the procedure, as well as the risks and benefits of the procedure, should be conveyed to the patient, and the patient should be able to relay back a simple understanding of the information given to them during the consent process. The specific details of consent for a paracentesis, including a list of the complications, will be covered in more detail in a separate video. Prior to opening up your supplies and draping the patient, be sure to thoroughly wash your hands. Once ready to position and drape the patient, be sure to drape your patient in a way that will maintain their dignity and not leave them exposed. When performing a paracentesis, having your patient in the supine position is ideal. Raising the head of the bed slightly can help move acidic fluid to the lower quadrants of the abdomen, and positioning the patient slightly on their side with the aid of a pillow under one side of the patient can also help to encourage loops of bowel to float away from your target area. These positioning tips are not necessary with every paracentesis, but they may be helpful. A timeout should be performed with your nurse at the bedside before going any further to ensure that you are performing the correct bedside procedure on the correct patient. Don't skip this very important step. Now let's go shopping for our supplies and discuss the items that will be needed for a bedside paracentesis. Most everything that is needed can be found inside our standard safety centesis kits, and we will go over the items inside this kit as well. Be sure to have enough Vacutainer bottles on hand to drain the desired amount of fluid when performing a therapeutic paracentesis. You will also want to have extra 1% lidocaine with epi on hand to ensure your patient's comfort, and extra ChloraPrep to ensure sterility of the procedure field. Sterile gloves in your particular size will be needed, a sterile urine cup and culture bottles for fluid and specimen collections, an extra set of needles for injecting lidocaine, a marking pen, and extra syringe, and a set of OR towels for making a large sterile field in which you can set things down. Now let's open up our safety centesis kit and go over its contents. Inside you'll find the paracentesis needle that will be used to enter the peritoneal cavity, with a syringe on the end for drawing back as you advance the needle. Here you see the over-the-needle pigtail catheter that will be threaded over your paracentesis needle and will eventually be left in the peritoneal cavity for drawing off fluid with the attached tubing and three-way stopcock at the end. There is a scalpel for making a skin nick, needles for injecting lidocaine, tubes for specimen collection, a 60 cc syringe for drawing off fluid specimens, a small amount of lidocaine, a syringe for drawing up lidocaine, tubing and drapes, as well as a band-aid here in this section. We'll go over this area with tubing much more during the procedure. And also a Sharps safety device is usually in the kit as well. What do you say we go window shopping now with our ultrasound to locate some fluid? The curvilinear probe is best to use when locating your pocket of fluid for a paracentesis. Be sure to apply a generous amount of ultrasound jelly to get a clear picture, and be sure to take your time on this step to identify the best possible location for accessing a pocket of acidic fluid. Typically, the best location is found in either the left or right lower quadrants of the abdomen, and far enough laterally to avoid the inferior epigastric arteries that run just lateral to the umbilicus. Anatomy and ultrasound technique will be covered in more detail in another instructional video, but while on a close-up of this shot, I'll just quickly point out the anatomy that can be seen here. Our acidic fluid is pointed out by a green arrow, the loops of bowel by a red arrow, and the tip of the liver can be seen and is indicated by a blue arrow. Mark an X over the best pocket of fluid with your marking pen once you have found an area that you are comfortable accessing. Or alternatively, you can use a pen cap or just about any other object to leave an indentation in the skin. Now it's time to open up the kit, but before doing so, make sure that you have donned your cap and mask with face shield to keep the inside of the kit from being contaminated. Watch carefully how this kit is opened so as not to contaminate the inside. Be very careful when opening the kit not to come in contact with the inside of the kit, as this will become your first sterile field.
Say what you mean.
You can then drop other items using sterile technique, as seen here, into your sterile field that you have created inside your kit. Next, open up your package of sterile gloves and put them on, again being careful not to touch the sterile surface of your gloves with unsterile fields. Watch carefully how these gloves are put on, being careful not to expose the ends of the gloves to non-sterile surfaces, and being careful not to touch or contaminate sterile areas on the gloves. Begin prepping the patient's skin with ChloraPreps, not just one, but twice, making circular motions going from the center outward. In the kit, you will find a sterile drape to cover the patient with. Remove the adhesive coverings on the drape and apply the adherent side to the patient with your prepped area with the X marked over it in the center of the circle of your drape. Feel free to drape a few sterile OR towels over the area to widen your sterile field a bit. Go ahead and go through your kit a little bit in order to get acquainted with the items inside. You'll notice that there are some items that will not be needed for this paracentesis. Just go ahead and place those items to the side. One oddity of the kit that I wanted to be sure to point out is the paracentesis needle itself, and how there are not just one but two protective plastic coverings. Be sure that both of these plastic pieces are removed from the needle, or else your over-the-needle pigtail catheter will not fully thread over the needle and fit snugly. This device has a safety mechanism with a retractable blunt obturator. When pressure is applied to the needle while inserting it into the peritoneal cavity, the obturator retracts and the sharp bevel of the needle is exposed, allowing penetration of the tissues. An indicator at the top of the device will turn red whenever the obturator is retracted and the sharp bevel is exposed. Once the peritoneal cavity is entered, the blunt obturator redeploys. This safety mechanism theoretically reduces the risk of organ injury and bowel perforation. Other advantages of this kit include a fenestrated catheter end, which facilitates rapid fluid removal and reduces clogging, and a pigtail mechanism that curves the distal end away from the intra-abdominal structures during advancement. This is the single straight, high-pressure tubing that will be used for paracentesis. Other tubing can be set aside during this procedure. Now find your lidocaine needles and syringe, and let's draw up some lidocaine. First, make a large wheal just beneath the superficial layer of the skin. Be sure to draw back each time before injecting to ensure that you have not inadvertently entered a major vessel. Next, anesthetize deeper and deeper along the tract where you will advance your larger paracentesis needle. Be very liberal with the lidocaine and take your time during this step to ensure patient comfort later on in the procedure. As you are advancing deeper and deeper to anesthetize the full length of your tract, you should obtain acidic fluid at some point and be able to clearly visualize it in your syringe as you draw back while advancing. This is a great sign that you are in the right place. Next, let's make a small nick with our scalpel at the site where you wish to insert your paracentesis needle. When placing your paracentesis needle, it's important to first retract down on the superficial skin layer before piercing that initial layer of skin. This creates what is called a Z-tract. In this method, the cutaneous tissue is pulled a centimeter or two caudad prior to needle insertion and advancement through the peritoneum. When the catheter is then withdrawn at the end of the procedure, the cutaneous entry site will retract to its original position, acting as a self-sealing skin patch over the puncture site through the peritoneum, which can help to reduce the incidence of acidic fluid leakage after the procedure is done. After applying that downward pressure to the skin, begin advancing the needle while pulling back on the syringe plunger. The hand on the syringe should be the driver that is applying forward pressure to advance the needle, and the hand on the skin should be a guiding hand that is applying downward traction on the skin while helping to guide the needle and ensuring that it does not overflex or overbend. Here you can see the red indicator become visible as the needle is being advanced, and then once the peritoneal cavity is reached, acidic fluid fills the chamber of the syringe. Be sure that once you have obtained acidic fluid, you still advance another few millimeters to ensure that not just the bevel of your paracentesis needle has entered the peritoneum, but that the lumen of your pigtail catheter has also reached the cavity. Once you are certain that your pigtail catheter is also in the peritoneum, then you may advance the pigtail catheter over the paracentesis needle, being careful to advance only the pigtail catheter and not the needle also. Remove the needle entirely once the catheter is in place and prepare for the fun part. First, use your 60 cc syringe to remove a generous sample to send off to the lab and to inoculate your culture bottles. The tubes that are provided in the kit may be enough, but when trying to make a diagnosis of malignancy, oftentimes the lab will require much more fluid, hence the addition of a sterile urine cup for more fluid. Next, attach the high-pressure tubing and connect it to a vacutainer bottle by piercing the needled end through the rubber vacutainer housing. If the catheter becomes clogged or stops draining for some reason, wicking the catheter by moving it gently in and out can unclog the catheter. Alternatively, you can inject a small amount of fluid back into the abdomen using a syringe and your three-way stopcock valve in order to free the end of the lumen from any clogging. Once the procedure is over, remove the catheter and place a band-aid over the entry site. Be sure to throw away all sharps in the correct container and don't forget to clean up after yourself. Thank you for watching this instructional video on how to safely and successfully perform a paracentesis.
Say what you